How many of you have been to the doctors and been asked how many units of alcohol you consume per week, or how many sexual partners you've had in a year? What if I told you your doctor may have added 7 to your answer? Okay, a bit nervous. Ashamed to admit that as a doctor, I have done this. And as someone who works in healthcare AI, I have had to work with data that represents this discrepancy. Now, we're told a lot about the value of data and its ability to drive insights, and health data is no different. When I mention health data, some of you are probably thinking doctor's notes, prescriptions, lab tests, blood pressure readings, and these are all very traditional sources of health data. And they play a critical role in allowing us to better manage your healthcare. But health data is the bane of my existence. It's messy, it's hard to access, difficult to work with, difficult to stitch together, and is fragmented. The health information systems that we have created are directly responsible for this, so much so that they do not optimize for health. Imperfect though it may be, your health data is critical for transforming healthcare. And there is a pipeline that connects the information in your record to researchers, allowing us to identify health patterns and create new therapies and treatments. We can use artificial intelligence to better predict risk of disease before symptoms even start. And we can analyze health systems for operational efficiencies and help push care into the home. Beyond the broad impacts on healthcare, this data is also useful for you personally. Now, some of you may have heard of the concept of individualized healthcare. This is the concept of tailoring healthcare to your individual personal circumstances, your individual environment, your personal needs, wants, lifestyle, even your own genetic makeup. While this is a promising vision of healthcare, it is currently stifled by how we view, manage, and process health data. I genuinely believe that we cannot achieve individualized medicine with our current health information systems, and a fundamental reworking is required to put the patient at the center of this. Consider this. You generate huge volumes of health data on a daily basis, but how much of that is under your conscious control? How much of your health story is captured when you go to the doctors and they go through a checkbox exercise while they look at their computer screen? And how many transformations of your health data occur and how many hands touch it before it even lands in front of someone who's responsible for making a decision about your healthcare? Have any of you even asked for a copy of your medical record? Some of you, that's good to see. These questions get to the heart of a soon-to-be $540 billion industry, one where your health data is commoditized and traded, often behind closed doors. Now, when I was first at medical school, a professor told me and other medical students that we were about to learn privileged knowledge, secret knowledge. It's also where I learned to add 7 drinks to your drinks tab. But what followed was a fundamental rethinking of how I view the world and an ability to find health data wherever I looked. The world was dripping in health data. I could smell it. People with Parkinson's disease give off a particular odor. I could taste it, the extra strong coffee I was drinking and the effect that that would have on my heart rate. I could hear it. I once diagnosed a man with syphilis based solely on the sound of his footsteps coming down the hallway before he even set foot in my office. Some very nervous-looking people here. So imagine my frustration and other doctors' frustration when we had to strip this technicolor world we're experiencing of vibrancy to fit restrictive EMR data fields. And for what purpose? Billing. Our health data is optimized for system performance, pushing patients through the system and collecting the dollars at the end. Fast forward to today, and the world is still dripping in health data. By some estimates, 30% of the world's data is healthcare related. That's a huge amount. But I would argue it's even more than that. Your DoorDash orders, plenty of health data there. Your financial footprint, that's health data. And believe it or not, your LinkedIn posts, that's health data too. And as a doctor, I have to say I'm very concerned about some of you on that last point. The world has fundamentally changed, but our health systems still operate on an outdated notion of what health data is. And it's these non-traditional sources of health data which will be responsible for the next generation of medical innovation. And, unsurprisingly, an industry of opaque data brokers has popped up to match supply with demand. But this growing industry faces several unique challenges. Firstly, patients can't easily participate in this market and control the flow of their data. Individuals have no oversight of who has access to their data and for what purposes. For researchers, accessing and working with this data is complex and expensive. And security data breaches, that poses a risk to individuals and society and helps fuel a black market trade in this commodity. And how much is all of this health data worth anyway? Well, an individual health record on the black market can sell anywhere between $10 to $1,000, depending on what's in it. But here's a better question. How do you maximize the value of your health data asset? How do you turn that $10 into $10,000? You have legal rights over your health data. That's not a philosophical point. That is codified in law. You have the rights to access your medical records. You can update the information in it to ensure its accuracy. And you can control who has access to it and for what purposes. You can monetize your health data if you want. You could go stand on the corner out there with a copy of your medical record and sell it to the highest bidder if you really wanted to. But our rights are only valuable if we exercise them. So what can you do? Well, for a start, request your medical record, ensure its accuracy, and get familiar with its contents. Engage with your health data. Use publicly available AI tools to become your own data scientist. And don't just sign up to services. Check what their data policies are and ensure that they align with your values and put you in the control seat. Now, many of you will go on to work in tech or in some form of research, and you have a responsibility too. Request data honestly with clear consent mechanisms. Give individuals control over their health data with usable and accessible platforms, and incentivize data liquidity through transparent systems that reward data sharing. At its core, this is an economic argument for a more effective, more efficient, and fairer health data market, one that puts individuals at the center and empowers them to be informed, autonomous agents, rather than passive data sources to be observed at arm's length. A market that is fundamentally built on transparency. As a physician, I need to know my patient. This is the core of the doctor-patient relationship. When individuals exercise their data rights, they don't just take control, but they have the opportunity to be better known and can better shape the future of healthcare. And that secret knowledge that I mentioned earlier is no longer privileged. It becomes democratized and accessible to all. Thank you.